Hi! For this video, we are going to talk about 5 random dental surgery instruments and their functions. And the 5 random dental surgery instruments are the following. We have the surgical suction, Stout Elevator, root tip pick, peritomes, and lastly, the micro lever. So let's start with the surgical suction. Surgical suction is used to remove blood from the area being operated on to allow surgeons to view work on the area. Suctioning is almost always necessary to remove excess saliva and fluids during a dental procedure. Well, the advantages of having suction is this maintains a clean oral cavity and can prevent choking and aspiration. It is also important to isolate the tooth that you are going to work with. And you must also use suction with patients when they cannot swallow or clear the airway on their own, when the equipment or a tooth breaks, posing an immediate risk of aspiration or choking, and when the patient expresses discomfort from accumulating saliva or other fluids. Now, why are you going to invest for a good suction? That is a really good question. Well, if the suction process does not work, visibility is lost, and then you will not have a proper or a clear working area. So you cannot work properly, or there may be accidents for when your patient might choke something or they are in discomfort during the surgery. So it's very good to invest on a good or a nice surgical suction. And the next random instrument is the Stout Elevator. Now, the Stout Elevator is used to loosen the tooth from the periodontal ligament and ease extraction. It is commonly used to extract third molars, and this features a concave working end. The situation that the Stout Elevator is used is, for example, is single-rooted teeth that have resisted attempts at closed extraction or that have fractured at the cervical line and therefore exist only as one root. Okay, the next instrument, we have the root tip pick. Root tip pick is a delicate instrument for the removal of root tips to difficult to reach areas. The situations are, for example, there is a fracture of the apical 1/3, 3 to 4 millimeters of the root that occurs during a closed extraction. An orderly procedure should be used to remove the tip from the socket, and then you are going to use the root tip pick to remove that root tip. Okay. The second to the last one instrument, we have the peritome. Peritome is a thin, sharp blade that is used to facilitate the removal of teeth with minimal damage to the surrounding alveolar bone by severing the periodontal ligament. So, if you want to have minimal damages on the on the alveolar bone, so you are going to use this peritome. And the last material is we have the micro levers. Micro levers is one step ahead in a traumatic extraction surgery. They can be valid, continuity, or alternative to our peritomes because thanks to their sturdiness, vertical movements, and gentle lever, work can be exploited. And that is it for the video today. Thank you. Have a nice day.